Welcome to all the listeners. I'm Dr. Ayush Gupta from Fortis Hospital, Vasant, Kunj, and today I will be briefly talking about the ill effects of air pollution. This air pollution problem, which we as residents of Delhi encounter every winter, and these bad air quality index days have somehow become a part and parcel of our daily lives now. So, in order to extract 420 liters of oxygen that is crucial for human survival and function, a total of 10,000 liters of air enters the lungs every day. So you can imagine, with such a large amount of air entering and exiting our lungs in a 24-hour period, how much or how many or what is the quantity of pollutants which we all must be inhaling every day. It is very difficult to imagine, and it is even scary to think that we are actually inhaling in our every breath so many pollutants, so many harmful substances which are affecting our health adversely. So, World Health Organization reports that in 2012, around 7 million people died as a result of air pollution exposure, confirming that air pollution is now the world's largest single environmental health risk. So, world over, it has been recognized and it has been proven scientifically that air pollution or worsening air quality index is associated with adverse outcomes, has several ill effects on our body. So, how do we measure this air pollution? The term which we all listen every day is the air quality index. The air quality index indicates whether pollutant levels in air are sufficient enough to cause any health concerns or not. It ranges from 0, which means least concern, to 500, which is indicative of greatest concern. And this is the chart which we follow for various action plans, as in when to close down construction activities, when to close down schools, when nobody should venture out, or when only healthy people should venture out of their homes. So we categorize from 0 to 50 good. We hardly see this kind of air quality index in a city like Delhi. 51 to 100 is satisfactory. 100 to 200 is moderate. We are mostly in the poor range for most of our winters, that is 200 to 300. Even very poor and severe ranges, which mean from 300 to 400 and 400 and above, are encountered frequently. They were seen in the post-Diwali period when we had to take the children had to take an early break from school. So this is just to know that where we stand: green, yellow, orange, or red category. And this also helps our policymakers to take decision at a larger level to protect the health of the citizens. But if we see that anywhere between this orange, red, and dark red, that is poor, very poor, and severe, it causes significant problems even to healthy individuals, right from breathing discomfort to headaches to easy fatigability. We feel tired at the end of the day. We do not know why are we having these prolonged coughs. We feel tightness in our chest. We have burning sensation in our eyes, and we are not able to attribute it to any other thing, but we eventually zero down to a bad air quality index J exposure or the air pollution. So the measured pollutants, what does this air quality index actually measures to arrive at a particular value? The major pollutants in the outdoor air are carbon monoxide, sulfur dioxide, nitrogen dioxide, particulate matter, which we call PM, and ground level ozone. So particulate matter is of particular interest because it is displayed as PM 2.5 or PM 10, 2.5 and 10 being the size of the particulate matter in microns. So particles of different sizes and structures that are released into the atmosphere are called particulate matter. These are present in many sources, including fossil fuels, dust, smoke, fog, etc. They can build up in respiratory system because once we start inhaling them, they tend to accumulate within our lungs, and they aggravate not only lung disease but also heart disease. And there is an increased risk of respiratory infection. We know that all the viral illnesses like flu, COVID, even bacterial pneumonias are known to occur or increase in the frequency and spread faster whenever there are winters and whenever there are bad air quality index days or worsening air pollution. So ground level ozone is another pollutant. At ground level, at upper level, ozone shields Earth from sun's harmful UV rays. Ozone is a harmful pollutant. It is formed from car, power, and chemical plant exhaust, and it irritates our respiratory system and even can cause asthma, reduces lung function by causing inflammation and damaging the lining of lungs. And what is smog? When the smoke or the pollution combines with the fog, it is called smog. Earlier in the winters, whenever we used to get up, we used to see that thick layer of fog used to envelop our city. But nowadays, or in these winters, especially after the year 2010, what we only see outside is a combination of smoke and fog, which we call as smog. This is very harmful for our health because these pollutants tend to remain suspended in the air which we are breathing. And this air is quite low because of the dense fog, which has now combined with these air pollutants. Global warming is another issue. The rise in temperatures because of this worsening air pollution. The phenomenon of acid rains. When it rains, it brings down all these pollutants onto the earth or onto the sea level or onto the ground, and even exposes people to direct the effect or the contact of these pollutants is there directly with the humans. Indoor air pollution. So this was about outdoor air pollution, but we also must remember that even the air which we are breathing inside our homes is polluted. Why? Because it is directly related to the outdoor air pollution. But the measures which we can take to control indoor air pollution are at the level of individuals. So as an individual, we can decide to purify our indoor air by using good quality air purifiers. Now, air purifiers, a lot of patients ask us whether they are useful, whether they are not useful, which one to buy, how to use them. So first question, they are definitely useful. That is the answer. Air purifiers will definitely improve your indoor air quality, and you will be spending or you will be exposing your lungs less to the harmful effects of polluted air, because as long as you are inside your homes, you are at least breathing clean air. But for that to happen, you must remember a few points. So you should buy an air purifier which is appropriate for the size of your room. If you buy a very small air purifier and put it in a huge open lawn or a huge open drawing room, it will not work. You have to buy an air purifier which is of decent size, which is used in a closed room. You have to close the doors and windows of that room so that the air which is circulating in that room eventually gets purified and cleaned of pollutants or particulate matter. Third, it is very important that these air purifiers should have an index or should have a display where you can see that these air purifiers are actually improving the air quality. What they display is PM 2.5 or PM 10, and particulate matter displayed should gradually keep on going down. Suppose you switch on the air purifier, it is 250 or 300. With passing time, it should come down to 200, 150, 100, 50. Means that your air purifier is working well. And third very important point while using these air purifiers is that you should maintain them well. It is not that you have bought an air purifier and you switch it on and it will keep on working. No, these have got various filters, HEPA filters, various carbon filters, layers of filters, and these filters need to be cleaned periodically. The machine gives an alarm. You should not reset it without cleaning it. And they even have to be periodically replaced, and they are easily available even on online platforms. So remember these things while using air purifiers, using an appropriate size, using it in an appropriate room with closed doors and windows, with a display indicator on to know whether it is working properly or not, and to periodically maintain it, clean the filters, and replace them whenever necessary. Apart from that, you can also take other measures like not burning cigarettes inside home or not smoking inside your homes, because that worsens the air quality inside the homes. If you're doing puja part every day, try avoiding burning camphor because that also creates air pollution inside. And in villages, in rural settings, many households still use biomass fuel, that is cow dung, uplas, chulas, to cook or to do their daily cooking. Those are the major sources of indoor air pollution, and you should switch over to cooking gas, though it may not be very valid in an urban setting like ours. So what are the various respiratory and lung diseases which are known to be caused due to air pollution, or they worsen because of air pollution. These are asthma attacks. We see a lot of patients coming in this winter season when there is bad air quality with worsening asthma episodes. Chronic obstructive pulmonary disease, the disease of smokers or smokers' lung, it also worsens during this season. Reduced lung function, the lung function of individuals, if we measure, they start to fall because if they are exposed continuously to high levels of air pollution. Lung cancer, it is caused by a series of carcinogen chemicals that enter the body through inhalation. So lung cancer has been attributed to air pollution, and air pollution is now a well-established cause of lung cancer in adults. Mesothelioma is another type of lung cancer or a pleural cancer, which is also associated with exposure to air pollution as well as to asbestos. And air pollution also increases the risk of patients or people getting pneumonia. So it has got a plethora of side effects, or it actually damages your lung a lot and sometimes beyond repair. Extrapulmonary effects also, it's not only the lungs which get affected, but leukemia type of blood cancer has also been associated with exposure to air pollution. Birth defects, immune system defects in children, falling frequently ill, low immunity, then heart problems, even stroke or brain attacks. Neurobehavioral disorders means you are not feeling well, or your behavior is not well, or you are easily irritable. Several neurological problems and developmental deficits occur due to air toxins such as mercury. Then liver and other types of cancer are also associated with air pollution, and even premature death. You lose a certain amount of your life to the continuous exposure of air pollution. So as we all are residents of, or whosoever is a resident of Delhi, it is a side effect of residing in Delhi that you will live less than your peers who are not exposed to the adverse effects of prolonged worsened air quality. So what are the health effects? As we already discussed, it can cause simple side effects or simple symptoms like headache, fatigue. It can cause various respiratory illnesses, which we just discussed, asthma, COPD, lung cancer. Then it can cause damage your heart. It can cause heart attacks. It can increase the risk of hypertension. It can increase the risk of brain attacks or stroke. It can upset your tummy. You can get frequent gastroenteritis, episodes of diarrhea, increased risk of nausea, vomiting, skin irritation, and cancer risk. So from no symptoms or subclinical effect to symptoms such as breathing difficulty, chest tightness, decline in lung function, increase in medication use, increase in hospital visits, emergency room hospital admissions, and even death. So the population which is affected by air pollution, the symptoms keep on worsening in intensity and severity as the air pollutant concentration increases. Therefore, it is important to measure AQI so that we know what level we are at and to take precautionary actions according to the concentration of air pollution as well. Now, lung function test. PFT is a pulmonary function test. PFT stands for pulmonary function test. They should be performed in two groups of people. One, who are smokers, and second, who live in polluted areas. So residents of polluted areas are inadvertently smoking somewhere around equal to 8 to 10 cigarettes per day. So it is not that we are non-smokers now. Our lungs may be as affected as that of a smoker because we are inadvertently, more the number of time we are spending outdoors, more the number of cigarettes we are smoking, or we are inhaling polluted air, which is equivalent to smoking a certain number of cigarettes. Therefore, even the residents of polluted areas are recommended to have a periodic lung function testing to detect early fall in their lung functions. So the question then comes that what can you do, or what can we do as an individual? See, government is taking its own steps. Policymakers are making various policies, but till now it has borne limited or limited results or very poor results at best. So we the citizens are actually left to fend for ourselves. We have to protect ourselves, our children. So what I would highlight is that what can we do as individuals or at an individual level to avoid the harmful effects or to mitigate the harmful effects of air pollution? Yes, we can ride our bike, or we can use electric vehicles, or we can use public transport. We should stay indoors as much as possible, or whenever there is bad air quality index day, we can work from home. We can choose not to go outdoors during early mornings or late evenings, so that is the time when there is maximum pollution. We should get our cars checked for pollution levels, PUCs, pollution under control certificates, not just from Challan point of view, but for our own safety. We should prefer to use petrol cars or electric cars or hybrid cars because they pollute much less. We should ride the school bus, make our children go to school via bus or do a carpool. We should use air purifiers at home, that I already mentioned. We should avoid biomass fuel smoke exposure, we have mentioned. We should clean our environment, avoid big gatherings. In COVID, we have avoided big gatherings, but in this wedding season, it is difficult to do. Social distancing and N95 mask when outdoors. COVID had a very terrible impact on all of us, but at least it taught us two good things. That is one, social distancing, and two, use of N95 masks. Avoid burning crackers this Diwali. This was an advice, a law which we all failed to enforce upon ourselves. We just got very excited on the day of Diwali, even this year, and burned crackers because there was a rain in Delhi a day before and the environment or the pollution was very low, and we had to bear the adverse effects post Diwali. A lot of things I have mentioned lie in our hand. We have to take responsibility. We just cannot go on blaming others or the government for everything what happens to us. It is our health at the end of the day. So we should at least do what each one of us can do to protect our own health, to protect our children's health, to protect our family's health. So it is important that we take the onus on us and do certain preventive things to reduce the air pollution or to reduce the impact of air pollution on our health. Another thing which we can do to restrain the progression of lung disease due to air pollution is regular health checkups. We should periodically visit or preventive health checkups, visit our healthcare professionals or hospitals and get our lungs checked. We should use N95 masks during bad air quality days because these masks prevent the polluted air to get into our lungs. These are protected. Therefore, they are called N95. I would describe it in detail. But 95 stands for that it filters out 95% of respirable pollutants. So only 5% of it we are inhaling. And we should also go for preventive vaccinations, just like we have childhood vaccination program. Now we also have an adult vaccination program where we vaccinate our adults. We vaccinate a high-risk people such as those with chronic lung disease, chronic heart diseases, neurological disorders with certain vaccines such as flu and pneumonia. So what is PM 2.5? PM stands for particulate matter, also called particle pollution, the term for a mixture of solid particles and liquid droplets found in the air. So some particles such as dust, dirt, soot, or smoke are large or dark enough to be seen with the naked eye. Others are so small that they can only be detected via microscope. So PM 2.5 refers to atmospheric particulate matter that have a diameter of less than 2.5 micrometers. So PM is particulate matter. 2.5 is the diameter in micrometers, which is about 3% of the diameter of a human hair. So we cannot see these particles. So why this is important? Because these are the particles which we are inhaling, and these are the particles which will remain inside our lungs and cause damage. Larger particles than these are filtered out at the level of nose, and smaller particles than these, or less than 1 micron, which are very small, they go inside the lungs and they come out with the breath. They don't settle or remain inside the lungs. So what is the most dangerous particulate matter size? That is 2.5 microns. And N95 prevents the entry of these 2.5 microns respirable fraction pollutants from entering into our lungs. So disposable N95 mask respirator is a safety device that covers the nose and mouth and helps protect the wearer from breathing in some hazardous substances. So person who is wearing this is protected against breathing in these hazardous or harmful substances. It is called 95 because it is designed to filter out at least 95% of the dust and the mold in the air. Use an N95 mask even if you cannot see the particles because they may be too small to see. As I mentioned, 2.5 microns, 1/3 of the size of the human hair diameter. So we may not be able to see them, but we are breathing them in. So N95 masks do not protect us from chemical vapors, gases, carbon monoxide, so certain types of pollutants. But yes, majority of particulate matter, N95 masks should be able to protect us. It is very important to ensure that while we are using these N95 masks, we are using them properly. They should be of an adequate size. They should fit our nose and mouth well. and the seal should be achieved around the nose and mouth so that there is no leakage of air from the side of this mask. So what we do is a positive pressure check and a negative pressure check. It's nothing but you wear the mask and blow out. So it's a positive pressure check. If you blow out, the mask should inflate, but there should be no air coming out from the side of the mask. And negative pressure check is you wear the mask and inhale, and then the mask should get sucked in or pulled into your face, and there is no leakage. There should not be any leakage around the side of the mask or into your eyes. So if both the checks are okay, then the mask is well fitting and it should work well for you. How to wear it? It must cover both the nose and the mouth to keep you from breathing in mold and dust. If it does not have a snug fit, it will not work properly. Correct fit of the mask requires contact with smooth skin, and even beards or facial hair sometimes makes it leaky. So, and always use straps on the mask to hold it in place to keep air from leaking. So you strap it around your head so that it is well fitting. So use of this N95 mask is not only important to prevent yourself from getting COVID, because now it is, in fact, it is also coming back nowadays, but it is far from that epidemic phase, but it also protects you from the harmful effects of air pollution, and it can significantly reduce the amount of pollutants or the polluted air which you are breathing in. And when to throw it, it's better that you use and throw every day one N95 mask. You should not, there is no, now it's not that costly. It's easily available. Gone are the days when you had to pay a huge amount to buy one N95 mask. So discard the mask on an everyday basis. Use one mask for one person and do not wash it. So what about vaccines? As I told you that in these bad air quality index days or worsening pollution days, we tend to get a lot of patients who are having flu, who are having pneumonia, because the cold air and the pollution acts as an easy medium for the viruses to thrive and even the bacteria to thrive inside our lungs. So these vaccines prevent us from getting this infection in a severe form. So what is a flu vaccine? Flu vaccine is needed every season. So flu vaccine basically prevents you from flu, that is swine flu, H1N1, H3N2, influenza. It is an influenza vaccine. So it is needed every season for two reasons. First, the body's immune response from vaccination declines over time. So you need to take this vaccine annually. So every year, one shot of flu vaccine will prevent you from influenza. Second, because these flu vaccines or flu viruses keep on mutating or changing their strains. Like we keep hearing the new strain of COVID coming in. First, it was Delta variant, then it was Omicron variant. Now it is JN.1 variant. So these are the mutations which constantly occur in these viruses. And therefore, we need a new vaccine strain every year. So it does not last beyond 1 year. The body's immune response goes down and the virus changes every year. So therefore, we need to take it every year. For best protection, everyone 6 months and older should get vaccinated annually, but this would be too much. So up to 10 years, yes. And beyond 65 years, yes. Between 10 to 65 years, those people who are having chronic lung diseases, chronic heart diseases, diabetes, hypertension, these people should get vaccinated annually because they are at a higher risk of developing severe pneumonia due to flu. So it takes about, also remember that if you get vaccinated today, it will take about 2 weeks for the antibodies to develop and provide you protection against influenza virus infection. Therefore, it is better to get vaccinated in advance before or just by the end of October. So that time has already elapsed before the flu season really gets underway. So now we are entering or going to experience this flu season in January, February. So now we are also seeing that there is not just one peak, but two peaks in a city like Delhi. One is the post monsoon peak, that is August, September, and one is the post winter peak or the winter peak, that is in January, February. So since we are having two peaks, we may choose to take vaccine in April, May also, when we have a new strain, when we have a new vaccine, or in the month of October. If you have any allergy to certain things or you have past history of allergy to vaccines, only then you need to not take it. Otherwise, it is recommended. And second vaccine, which is recommended, is pneumonia vaccine. If pneumonia vaccine works against the bacterial pneumonia, that is pneumococcal or streptococcal pneumonia. That was a viral vaccine. This is a bacterial infection vaccine. So there are two types of vaccines, and pneumococcal conjugate vaccine is recommended for children and adults above 65 years of age. And The second vaccine, that is pneumococcal polysaccharide vaccine, is only advocated for adults more than 65 years of age. So for adults, we have two types of pneumonia vaccines, which we need to take one after the other. But we need only one shot of these vaccines. These do not have to be taken every year. So these are easier to take, easier to administer, one shot, and you are then protected. So I think I would wind up my talk here and open the session for any question answers. What I wanted to highlight today was the adverse effects of air pollution, what exactly is air quality index, what we can do at a personal level to protect ourselves from the harmful effects of air pollution, and what is the role of preventive strategies like vaccinations in protecting our lung health. Over to the organizer for opening the session for question answer. So the first question is that what are the indoor or what are the sources of indoor air pollution? So indoor air pollution, as I mentioned, it is number one directly related to outdoor air pollution, because the outdoor air will enter our homes through the doors and windows. So if the outdoor air pollution is high, we will have a high level of indoor air pollution as well. The second source is the burning of cigarettes, which causes smoke inside our homes. So if you have a smoker at home, he or she can be the source of your indoor air pollution. And third, as I mentioned, while doing puja activities, or we burn camphor, we burn agarbattis, all these are sources of indoor air pollution. And fourth, the cooking. While we cook, there are a lot of fumes. If you're not using an exhaust or a chimney, these can be sources of indoor air pollution. So these are certain sources of indoor air pollution which we can cut down upon, which we can manage with the use of air purifiers, and which we can, obviously, these are modifiable factors. We can modify the sources of indoor air pollution and control the level of indoor air pollution. So second question is that do electronics and batteries are also harmful? Yes, they are, because electronics and batteries do not cause pollution immediately while they are in use. But when they have lived their life, when it is the time to discard them, at that time, they are a major source of pollution. They can pollute your water, they can pollute your soil, because where do you discard these batteries? Either you dig them up into soil, or you discard them in water, or you cannot obviously burn them, they will cause fire. So it is difficult to discard these batteries and gadgets. So this is the e-waste which we are generating, and though they are not causing pollution immediately, but at a later stage, when the time comes to discard them, they also become a source of pollution. So we have another question from a person who says that I'm chronic asthmatic and regularly on Monter LC, which is the name of a medication, and use Astelin, and now being prescribed Levolin. With increase of pollution, the congestion is increasing and can't breathe at all going out. What do I do? Okay, so this is a very common scenario for many of our asthma patients. They feel more and more congested, more and more difficult to breathe as the pollution goes on increasing. So there are no easy answers to it. Yes, we are working to reduce the exposure of air pollution on our health, which I have just highlighted. You should use a mask, you should reduce exposure to indoor air pollution, you should use air purifier within the confines of your bedroom, you should try to stay indoors, especially during early morning and late evening hours. But you also need to intensify the treatment of your asthma. Asthma treatment won't be suitably treated or appropriately treated with Levolin or Astelin alone. You have to switch over to an inhaled corticosteroid inhaler, which is like a combination of budesonide and formoterol, which will significantly reduce the symptoms, reduce the congestion, which is being caused by the pollution. So you need to consult a chest specialist or a pulmonologist. You can reach out to us and optimize your asthma care plan and optimize your asthma treatment and reduce the exposure simultaneously of pollutants on you. So the next question is that what are the steps to recover from exposure to traffic, air pollution, PM 2.5 and PM 10? Okay. So once you have been exposed to the effects of adverse air pollution, you have been out on the field, or you're out throughout the day, and the day was bad in terms of air quality index, and you come home, your eyes are burning, your chest is tight, you are wheezing, or you feel tired, fatigued. The only way to get rid of this is take rest and stay indoor for the next day, because eventually this pollution effect will wane off, and it is important that you do not re-expose yourself to the same amount of pollution which you have just undergone. There is no way to detoxify your body once the pollution has affected you. But yes, you can reduce the amount of pollution or the duration of pollution on subsequent days to recover faster from the adverse effects of pollution. Suppose you get affected by the pollution on a day, you sleep in the night, and the next morning you again go out and again get affected, again come back with the same symptoms, you are going to enter into a vicious cycle. So only way to recover is to break the cycle, to stay indoor for a day or two, avoid the exposure of your body or your lungs to bad air quality. Use masks whenever you venture out. Do not go out in early mornings and late evenings. Do not exercise outside during that time. We have a lot of early morning joggers who are obsessively or compulsively, they have to go out and jog in the morning hours. So they have to refrain from that. And this is how you can recover from the exposure to this pollution. So the next question is, I am doing field work outside, so how I can protect myself from pollution? So I mentioned, if you are on a field job, you should use N95 mask or at least a simple face mask to reduce the exposure of pollution on your body. You should keep yourself well hydrated, keep drinking water, because especially in winters, you don't feel that thirsty. So you tend to avoid drinking a lot of water, but you should keep drinking water, keep yourself well hydrated, wear a mask, do not go out, even if you are on a field work in the high pollution time, that is early morning and late evenings. Try to plan your day in a way that you are working from 10 to 4 type of time when there is sunlight and when the pollution levels are little low. Then in between, you can, even if you are on the field, you can choose to be in an area which is like not very dusty. You can choose to enter a park and take some rest, or a garden which is full of trees, and you can rest your body for some time. So these are some methods which will help reduce the amount of pollution which you are exposed to, even if you are working continuously outside. So the next question is fog mixed with pollutant called a smog? Is there a way for common people to know the type of pollutants in the smog? Okay, so I mentioned smog is, yes, you have correctly mentioned, when fog mixes with smoke or the pollutants, it is called smog. Why is it more harmful than simple pollution? Because the air pollutants or the pollutants which are harmful for our body remain suspended with this fog low in the air which we are actually breathing. It becomes very low and close to the level of the sea or close to the level of the earth. So therefore, it is riskier than other forms of pollution. And the types of pollutants, these are the same pollutants which are in the air, which I mentioned. The air quality index, the 5 pollutants which are majorly measured: nitrogen dioxide, carbon monoxide, ozone, particulate matter. These are the pollutants which are there in the smog as well, because smog is nothing but the bad air mixed with fog. So whatever pollutants were there in the air, they are there in the smog as well. Are indoor plants effective to controlling pollution inside house? No. These plants or even air purifying plants are not scientifically proven to improve the indoor air quality. Only air purifiers are scientifically proven to do so. I think we have had a good discussion, because so many questions coming from you have enabled me to highlight the importance of, or the points which were relevant to you. And answering these questions, I hope, has granted or given further clarity to my talk. And another question is that what kind of good diet we can take to combat air pollution. Good diet means a healthy, balanced diet. It should have carbohydrates, proteins, fats in a good mixture or a good proportion, combined with vitamins and roughage with adequate amount of water. That is what a good diet is. So you should not just eat carbs or only eat fats or not eat fats at all. All these are bad habits. You have to have a balanced diet. If you are not able to achieve one, you can consult your dietitian, get a diet chart plan, and follow the diet plan. Thank you so much. Thanks for having me here. I'm really pleased. Thank you.